fam, welcome to my channel. If you're new here, this is Ada and Eri, where we talk about health, lifestyle and food. In this video, we'll be talking about something that can happen anywhere, anytime and to anybody. This is a healthcare emergency. Anytime it strikes, life is lost unless something is done very fast. Today we'll be talking about cardiac arrest. And funny enough, this doesn't only happen to old people, it also happens to younger people. So listen so that you'll get tips on how to prevent this cardiac arrest. Practical tips on how to prevent cardiac arrest, because once it comes, it takes the grace of God for one to survive, and especially immediate medical action. I will also be teaching you what to do immediately you see somebody undergoing a cardiac arrest. Something you should do immediately to save the person's life. Stick around as we dive into it properly. Cardiac arrest is when the heart immediately stops beating. It is different from heart attack. Heart attack is when the blood vessel supplying the heart is blocked, preventing blood to be supplied to the heart so that it will distribute it. It is different from cardiac arrest. In cardiac arrest, the heart stops beating automatically. This is dangerous and this is life-threatening, because all the organs that need blood supply in the body to function, like the brain, the kidney, the liver, all the vital organs in the body are automatically shut down. So this places the individual at the risk of losing his or her life. In Nigeria, we love food. We love chopping life. In fact, if you want to take care of yourself, the first thing that comes to your mind is to go to an eatery, order this, order pizza and all that. And most times these things are fried. These things contain a lot of salt. These things are refined so much. So the first step in preventing cardiac arrest is to watch what you eat. Eat less of fried things. Eat less of refined things, including sugar. Eat less of salt. These are things that go and form little something in your blood vessels, and it will lead to the heart pumping with a lot of pressure. That is what leads to high blood pressure, and over time this weakens the heart, and the heart can just shut down like a phone with low battery immediately. So the first step is to eat healthy. This includes eating vegetables, ugu, water leaf. We have a lot of vegetables in Nigeria: cabbage, lettuce, carrots, all those. These are things that you should be consuming on a daily basis instead of taking refined stuff and all that. And we also have rich drinks like zobo and soya milk. These are healthy options that you can look at if you want to eat healthy, because eating healthy is one of the major steps to preventing cardiac arrest. You might overlook this, you might think it's not important, but research has shown that most of these things we consume contain harmful things that can over time lead to serious health issues. More healthy food choices include fruits like banana. Banana is very good for the heart. It has potassium, which helps the heart to function very well. We have okra, we have oranges, we have most of the fruits are actually very good for the heart. So these are things that you should prioritize in your diet more than all these refined things. In fact, drink water instead of drinking refined sugar. Instead of taking a fizzy drink, all these cola and all that, take water. These are things you can do and your life will be better for you. The second advice is move your body. Move your body. In fact, you don't need to register in the gym to achieve this, especially if your type of job is the one that you sit for a long time in a particular place. Prioritize moving your body. When I mean moving your body, I mean engaging in activities like walking around, sweeping. Make it intentional that you do activities that help you move around anytime you get the chance. In fact, I would recommend you move around at least 30 minutes every day. This can include just walking around your compound, taking a stroll around the streets, or if you wish, and if you can maintain the routine, you can actually register in the gym. But the main thing is exercise your body from time to time. Don't just sit in a particular place day in, day out. This is not good for the body, especially the heart. Once you exercise, once you move around, you actually strengthen the heart. Movements, activities help you strengthen the heart. If you don't engage in that, the heart can actually become weaker, and when it shuts down at any time it chooses, that is what is called cardiac arrest. So move your body. The next one is know your numbers. When I mean your numbers, I mean your blood pressure and your sugar level. These are two major leading causes of cardiac arrest. When your blood pressure is high, with time, the heart, having pumped with great pressure over time, becomes weak. And when it becomes weak, what will it do? It will shut down fast and furious. This is what causes cardiac arrest. One of the leading causes of cardiac arrest is high blood pressure. Over time, high blood pressure. And funny enough, blood pressure is not usually elevated only in older people now. That is what makes it even more dangerous. Now you can't say once I'm 40, once I'm 50, I will start monitoring my blood pressure or start monitoring my sugar level. You can have a 25-year-old person coming down with high blood pressure. So monitor your blood pressure now. What is your current blood pressure now? In our current generation, due to a lot of factors, young people also suffer high blood pressure and need to be monitored. Young people also suffer high glucose level and also need to be monitored. And funny enough, all these tests are very simple. You can actually get them free in clinics and pharmacies. Just walk into a pharmacy and or a clinic in Nigeria or elsewhere and tell them you want to check your blood pressure or to check your sugar level. Most times they are actually free and you will know what you're dealing with to prevent you from getting cardiac arrest, which is always sudden, dangerous and fast. In as much as cardiac arrest is usually sudden, sometimes the body gives you little signs to signal you that something is about to go wrong. I will tell you some of the little signs that you might see in your body if cardiac arrest wants to set in. And do not neglect these signs. Do not say they will pass by, because this is what puts a lot of people into danger. First, once you start having these signs, go to the hospital for proper assessment. The first, you start having chest pain, shortness of breath, you collapse at any point, or you feel tired easily. These are signs that your heart is in problem. Do not say these signs will pass away. Do not say, is it not just this? After some time, it will go. Go and see a doctor immediately or access medical help. The two main things that are predisposing factors to most health challenges are smoking and alcoholism. Taking alcohol in excess and smoking. And cardiac arrest is not left behind. Smoking and alcoholism predisposes you to heart failure, which can also lead to cardiac arrest. So why smoke? So why take alcohol? Quit smoking and quit alcoholism to save your heart. Let's say somebody immediately collapses in front of you. What do? If you meet somebody having cardiac arrest, what do? First of all, call for help, because most times you can't do everything alone in an emergency case. You need help, especially to move the person to the hospital as you are doing any other intervention. So call for help first. Then secondly, do what we know as CPR, cardiopulmonary resuscitation. This is a life-saving skill that every adult, even children, should have, because this can save life, especially in cases of emergency, cardiac arrest or any other emergency, and especially in cardiac arrest, because cardiac arrest is that the heart stops breathing. It means pressing on the center of the chest for at least 100 to 120 times in a minute. This is a simple definition of CPR. This is a layman's understanding of CPR. CPR. If you want me to do a detailed video on cardiopulmonary resuscitation, that is CPR, let me know in the comment section and I will do just that. Let's do a quick recap of the tips to prevent cardiac arrest. First is eat healthy food. Second is to move your body. Exercise as often as you can, 30 minutes a day. Thirdly, avoid smoking and drinking. Fourthly, know the warning signs of cardiac arrest. Then, learn cardiopulmonary resuscitation. If you got value from this content, kindly let me know in the comment section. Thank you for watching and God bless.